first rib, so I'm not even going to talk about
First ribs in front.
first rib in the back here where it intersects with the spine. First rib also, if this is his clavicle here, anteriorly the first rib is under the clavicle coming in to attach to the top of the manubrium. Here's his angle of Louis, right? Here's his angle of Louis. Here's the manubrium, this big square. Here's the first rib kind of surfacing here under the clavicles that we can see. But I'm back here where the first rib comes back into, I'll give you a blanket apology for spitting on you.
No problem.
To the spine.
So here it is articulating to the spine. And what I feel first is the first one's high on the right. So
you can see
Catherine.
that. So,
And
rib
left.
on the right
So
side.
right side is the high side, the left is the low side. The interesting thing, it's consistent with the diaphragm. The lower rib cage was high on the right and low on the left. Those first ribs are consistent with that. Now I'm going to verify that. Normally a rib that's stuck up likes inhalation, hates exhalation. And a rib that's stuck down likes exhalation, hates inhalation. Right? It's stuck in inhalation or exhalation. So take a big breath in, and the right one goes up, exhale, and the left one goes down. So that kind of validates and just kind of reinforces what we've already been observing and thinking we're seeing. Okay.
Tell me again, which likes high and
Think about it. What does your first rib do when it inhales?
So if it's high, it likes inhalation?
Yeah.
Okay,
Yeah. It likes where it's stuck toward.
right.
That's simple. So the first thing I'm going to do is I'm going to treat the low first rib, the low side. Remember how we do that? Use the arm. So I'm going to come up. I'm going to find my tender point right on the front, the leading edge of the trap.
No, you put it on.
And I'm going to bring his arm out.
Remember? Yeah.
That hurt there?
A little bit.
So we'll go up a little bit. How's that?
A little better.
In there?
A little better.
Good. Pull your elbow down to the floor. Please. And release. How's that now?
Not much different.
You mean in terms of what number is it?
Do it again. 4?
4? Okay.
4 to 4.5.
How about that?
Very good. 3.8.
Is he pulling down while you're testing right now?
What's that?
Is he pulling down while
I
you're
had to do that once, but not now. Let's bring him up. How's that now?
That's better.
Yeah. So move the blanket if you have to get his arm up. A major trick. Okay. Now pull down, please. Not so hard. Now relax. Let go.
Can you say once more where that point is to check?
Yeah, the point is on the anterior, halfway between the shoulder and the neck. The point is on the anterior edge of the trapezius.
It's on the slope down.
It's on the anterior slope as it's going down and forward. You can see where my finger is. Pull the shirt back if you want to. There, that's it. We did this before. It's in the book too. There you go.
Look, oh yeah. Usually that's a very tender spot too.
Mm-hmm. Yeah. But this one spot, okay. So we're there. Now, often the first rib is released sitting, but it's side bend away, rotate toward, right? So what we're doing, because we want to take the spine toward the position of distortion. If we think of right side high, we want to side bend to the left so that the right side will lift up and match the distortion of the rib. So what I'm going to do is see if I can do this without having to sit him up. So I'm going to find the point is right behind the first rib depressed point. It's in the posterior aspect of the trap. And it's like right there. It's hard to see. We've done this. You can find it in this book. I'm going to side bend away until I feel that kind of melt. And I'm going to rotate toward just a little bit. How's that feel there?
Better. Much better.
So this is just as effective lying down as
Yeah, well, yeah. You can assume that because I'm trying it. It's potentially as effective. If it's not, I have them sit up.
If you were sitting up, you would side bend away.
I would do exactly the same thing and rotate toward, yeah.
And rotate
Oh,
towards.
I see.
That's the
Side
one with
bend,
the
rotate.
holding him by the, towards
Yeah.
the higher.
Yeah.
Oh, yes.
So we're just
Rotate
reproducing.
towards and
If
stuff.
we already think about the shape, right side high, left side low. All we're doing is moving him to reproduce that shape.
Ooh, that's not
So if you're
too
gonna
shabby.
reinforce this with him pressing, he would press,
Only if I
Yeah.
have to.
no, if you were to, it would,
I could have him go this way. So where do I perceive the restriction? If he's too tight here to go over enough to release that, I could have him push your head to the right, please. And release. Right.
Oh, you always take it to slide after.
Yeah, sure.
Could you have him press into your thumb where the trigger point is with the shoulder? Did that?
Yes, you could. Push your shoulder up into me. And release.
Oh, that's a good one.
Yeah. The other ribs, you're actually using the shoulder as a lever and the arm as a lever. I will sometimes seated put my leg on the table and put the elbow on my knee and add the arm leverage to that. But mostly I find that using the head leverage and neck leverage is sufficient for the first rib. That feels pretty good. Feel it's going to float and melt. Okay, so so we've handled the high and low side. Now, what else do I feel here? Feel that the rib on that low side is in the anterior is quite low, quite sore and low. So I'm on that second rib. It's a good spot, huh? And so let's have you lift up your head, turn to the left, ouch, and then try to squish my thumb with your chin.
So go towards it again,
Yeah.
fold into it.
Yeah, you fold into it.
Fold
Release.
into it. Oh, nice.
So in this case, we're side bending toward and rotating toward.
And this is on the low side.
This is the low side. This is a hugely important shoulder point. This is for depressed second rib anterior.
So this is the second rib, can I put this on low
Yep.
side?
Yep.
Second rib,
Second rib anterior is on the low side.
and your thumb is on the second rib.
Yep. Along the mid clavicle. You can find the second rib easily because it ends up in the angle of Louis. Right smack dab in the middle. Its axis goes right into the angle of Louis in the front and goes right into T1, T2, into the disc in the back. Cool, eh? Good. Wow, that's really very active. Okay.
Before you take your thumb off, can you just for a second? So you're saying that this vector is going into
Mm-hmm.
the PCO, VCD, Vita?
What?
Going into the pericardium and the, you
Oh.
said into the angle of Louis into T1 and T2?
No, the rib.
That's
The rib comes.
The rib,
The rib comes into the angle of Louis.
oh, yeah.
Yeah, in the front. Here's the angle of
Oh,
Louis,
okay.
and second rib comes right into it.
And in the back?
And in the
You're
back,
saying
it comes.
it's T1, T2.
Well, yeah.
Okay,
Okay. So that's the second rib anterior on the low side. The other thing is if we come, we're going to find a really strong tender point because this whole cervical spine is pulled down with the ribs, right? Part of that shape. This little guy, that's sore?
Yeah,
It's even sorer.
yeah.
And yeah. So that's C6. That's the C6 point anterior, which involves almost no flexion and almost pure side bending. So what are we doing? We're doing almost what we did with the first rib, but without the rotation. It's pure side bending and maybe a teeny bit of rotation away.
So that's C6?
C6
C6.
anterior, and I would put anterior / lateral. Just pure, how's that feel when I do
That's
that?
on the right or left?
It's on the low side.
It's on the low side.
Forget right or left, it's low side.
Okay.
Do you see how I'm going to the low side with it?
Yes, I do.
Yeah, that's all that matters.
Sure what you were, which point you were touching there. So.
Yeah.
And your,
So it's a bottom, And you probably find something like that at the C7 place. But what we're doing is exaggerating low left, high right.
Lots of side bending,
Lots of
a little bit of rotation. You're getting the ear to the point now. Forward.
Good. Now we're also looking at anterior points on the high side, which you can see him. You can see how his head's turned with the rib. And we're going to look at C5 anterior and C4 anterior. C5 is sort of nasty. So you're going to flex him, rotate away, side bend toward. How's that now?
Better.
Gone?
Do it again. Maybe a 1.
How's that?
Good. Maybe a half.
Okay.
You can see how
Take your hand.
quite a bit flexions that flex.
0.37?
You can see
Let's
how
see.
that flex when it's higher up to engage it. If you just
0.2.
side bend it, it wouldn't even get it. Yeah, again, he's following the shape, right? Yeah, following the shape. The shape.
Yeah, it's all part of the
The
shape.
distortion. Oh, yeah. Yeah.
You like matching the distortion.
How's that point?
Yeah, that's really,
Shaking.
it's
Mm.
liking
It's a
that.
different point.
Maybe 2, 3.
Tissue
Okay,
to the
so-
distortion.
How's that?
Better.
That's a C4 point. There's more rotation, a little
Took
less
care of
side
that
bending.
too, huh?
Yeah, well, I just moved up one. When I felt that C5 was handled and happy, I just slipped my finger up one segment to C4 and said, how's that? It wasn't quite good because I wasn't as fine-tuned. So I add a little bit more flexion, but a lot more rotation.
And C4 came in,
Yeah, yeah.
started to play. Okay,
Yeah.
I'll play.
So C4 is part of this picture too.
Yeah. And you don't have to bring it all the way down, you can just like,
Yeah,
Oh.
there you go.
subtle judgment.
Yeah.
Subtle judgment.
You hear it talking.
You okay in there?
Yeah.
How you suffer. And then, because the clavicle involvement, I know that there's a C8 point,
Yeah.
right? Part of the same. It's really not high as much as high and that distortion, following the pattern of the rib cage too. So this clavicle here, so, and you can C8 anterior on the right. Lift up your head a little bit. Turn your head to the left. Relax it. Let me take you out.
So you.
And now push your head straight back into me. Strong.
Total side bend, side bend and flex and side bend. He's
Relax.
rotating away.
Rotate away.
I'm rotating away and I'm side bending toward with extreme flexion. It's on the wall over there. C8. How's that now, man?
Good.
Side bend and extreme flexion.
Notice where my elbow is. I wouldn't want to be doing this, relying on muscles to hold his head up. You know, I'm really off the hook because I'm holding him.
And
How's that now?
Good.
what's that, the
Flexion.
One more time.
Extreme flexion.
extreme flex.
Side bend toward,
Side
rotate
bend.
away.
Rotate away, side bend.
Oh, don't do that, Catherine. I just want the point.
Okay.
Not necessarily. You assume that people will know how
Figure
to
out.
treat the. Because there's nothing we're doing with C8 that's non-typical. It's all the same way it normally would be. Now the whole front. I mean,
Feel that?
whole front of his chest is changing shape with this.
It's like taking a breath that hasn't been able to do for a while.
There's that word again, Elaine. Mediastinum. The English call it mediastinum. You've heard of mediastinum?
Yes,
Figures.
because I see it written. I only see it written, and that's where I've always pronounced it.
And there we are in the mediastinum, up from the umbilicus,
Because when you read it, that's the way you think it is.
part of the musculoskeletal system.
Mediastinum?
Mediastinum.
Yeah, I would say mediastinum when I read it.
Oh, really?
I